Facial reshaping procedures have evolved over the years, as opposed to the older times when it was just a matter of coming in and getting a surgical lifting procedure. Now we try to use a three-dimensional approach to facial rejuvenation. Many times this involves actually adding volume to the face, where over time the natural volume has decreased. It's designed to make this a natural appearance, not making something that isn't necessarily supposed to be there to begin with. The spectrum of fillers that we use to give the face a more youthful or more rejuvenated appearance involve some of the in-office procedures, such as using Juvederm or Restylane or their family of products that we are able to add volume, and these products have a spectrum of advantages that might be right for one patient, whereas we might use a different type of injectable for another patient, or sometimes we use a combination to match what we want to achieve. When we do our fat transfer, we'll most of the time get some of the extra fat from around the belly button area, and then we'll put it through a process that makes it ready to be placed into the face, and most of the time we'll place it into areas around the cheeks, sometimes around the lips, and sometimes in the area near the eyebrows called the temporal area.
So my mom came here she's older, and so she's just trying to keep looking young and youthful, and she looks awesome. So he's done a number of fillers on her, and then she also goes to Lena as well to get facials and microdermabrasion and stuff like that, but her skin looks awesome. So she is going to be 60 on Thursday. It doesn't look it.
I just continued to come to him. I've had some Botox done. I actually had that, I don't know what it's called, but I had that under eye, kind of the fatty bag removal. I don't know what it's called. So,
Fatty bag removal.
Fatty bag removal. That's the regular person term, not the doctor term. And then I had...
What's it?
Blepharoplasty, where they take the fat tissue out from underneath the under eye. And then I've had some Botox, and then I've had some lip injections from him.
I have an eyebrow that goes higher than the other on one side, and Dr. Abramson uses Botox to raise the eyebrow on one side and lower it on the other. I also use it on the laugh lines. It softens them. I use it on the chin. It softens lines there, also the pulling that happens. I've been using fillers in my face for about 12 years now.
Fillers he's done down here and in between my eyes, and I think that's about it for the fillers, but usually it's Botox around my eyes, and sometimes down here, because at night for some reason I don't know why, but it's like, where is this wrinkle coming from? And it's how I sleep, so it's the strangest thing.
Recently, with the facelift, he's done a fat transfer, and I'm just starting to see results. Initially, it looks very full, goes down a little bit, and then it's starting to come back again, and I'm really happy with how it looks. And I'm hoping to do a little bit more in other places now, too. That's how happy I am with it, and it lasts, I guess, a very long time, I guess forever. So I'm very excited to maybe try it in the hollows in my eyes and a few other places, because I think the results were great. And it's so much easier than having your face filled with filler every 18 months.
And I like his work because it's just very subtle. I mean, I think he kind of gauges what you like as a patient, and I like the subtlety look of it, so he just does it to where it's kind of like a little enhancement for me, but nothing that's kind of over the top.